Today we're going to be talking about preventing complications, specifically with fillings and crowns. My name is Dr. Anand Choubal, and welcome to the Dental Corner. Now, when the dentist does a filling or a crown, there is going to be some drilling on the tooth, and this drilling creates some inflammation. If it's a large cavity or a crown prep, there is going to be more inflammation. Then when the procedure is done and you close and you leave when you're numb, that inflammation is still there. And there are things such as clenching, grinding, or eating hard, crunchy foods that keeps that inflammation elevated. And if it stays elevated for too long, that's when the tooth becomes sensitive. Now, if the tooth stays inflamed even longer, a few weeks, few months, that's when you may get into the root canal zone. So our key ingredient is to use Advil to reduce inflammation. Also, we're going to recommend that you consciously try to keep your teeth apart during the day as much as possible. We all clench and grind, but rarely feel it. If you're able to do that, keeping your teeth apart, maybe switching to a soft diet, especially on the teeth that were worked on, take your Advil every 6 to 8 hours, the tooth will return to normal much faster, which is our goal. Now, when we're doing a small, little tiny filling that maybe doesn't even need any numbing, maybe we don't need to do all that. But what we do is we gauge the size, the depth, the amount of trauma, because dentistry is traumatic. So we gauge the amount of trauma and then we decide, John, I want you to take your Advil every 6 to 8 hours for approximately 4 days. Other cases, a little more trauma to the tooth and the patient has a really high bite force, we actually may recommend 7 to 14 days. Now, if we can see really aggressive signs of grinding or clenching, the teeth are all flat, we can see it, we may actually recommend a mild muscle relaxant to minimize the amount of force that you put on your teeth. Why? Because the less force you put on your teeth, the less inflammation there's going to be. We do all these things together. Now the tooth can recover fast. And what should happen is after a few days, you should feel like nothing was done. You shouldn't feel like the tooth was worked on. And that's satisfying as a dentist.